Hello friends. So today actually we are basically going to talk about a tragedy which took place during a routine CT scan test, and we will also discuss about the preventive measures which we can practice to avoid these types of unfortunate incidents. A routine medical test turned fatal in Brazil. Actually, 22-year-old law graduate Leticia Paul went for a CT scan at a regional hospital to check for kidney stone related issues. And moments after receiving a contrast dye injection, she suddenly collapsed into anaphylactic shock, which is a rare but life threatening allergic reaction. About this reaction, I have already told you in my previous video, and I have also provided the link of that video in my description section. So from where you can watch that video also. And despite quick medical intervention, including intubation and ICU care, she passed away in under 24 hours. This tragedy highlights that even commonly used substances like iodinated contrast dyes can have severe risks for at-risk individuals. Medical experts advise that before imaging, patients' history related to known allergies, asthma, or previous contrast should be discussed and ensure that emergency protocols and adrenaline or epinephrine injections are always available there. And these contrast dyes, especially iodinated contrast used in the CT scans or gadolinium contrast used in MRI, can sometimes cause severe anaphylactic reactions. These are unpredictable, but certain preventive measures can reduce the risk. For example, number one, proper history taking. Yes, it is very important. Always ask the patients about previous reactions to contrast dyes and history of drug allergies, asthma, or severe allergic conditions. These things can also increase the risk. So these points must also be asked. And number two, pre-medication in high-risk patients. If imaging is essential, high-risk patients may be given prophylactic drugs, for example, corticosteroids like prednisolone or methylprednisolone, and antihistamines also, and sometimes montelukast, which is a leukotriene blocker. These drugs are also added. And number three, use of low osmolar or iso-osmolar contrast agents. These newer formulations are safer and cause fewer allergic type reactions compared to older high osmolar dyes. Low and iso-osmolar agents are commonly available in the market in most tertiary care centers and private hospitals. Okay, and number four, alternative imaging methods. If possible, use ultrasonography or MRI without contrast or non-contrast CT to avoid the risk entirely. Number 5. Emergency preparedness. The radiology suite must have adrenaline auto-injector or epinephrine, oxygen supply, IV fluids, airway management tools, for example, ambu bag and intubation kit. And yes, about the adrenaline auto-injector, I have already told in the same video, in the anaphylaxis video. So you can watch that video also. Link has been mentioned in the description section. And it is also very important that the staff must be trained for immediate recognition and treatment of anaphylaxis. And number 6, test doses. These test doses are not reliable. Yes, unlike penicillin allergy, these test doses of contrast dye are not recommended because reactions are not dose dependent and may occur even after small amounts. So safer alternatives should be used. For example, these low osmolar or iso-osmolar contrast media, that is LOCM and IOCM, these can be used as safer alternatives. And high osmolar ionic agents are hardly used nowadays. So in this context, what are the essential duties of medical personnel? So here are certain ethical and medico-legal responsibilities. Doctors should inform the patient about risks and available safer alternatives, especially in patients with previous contrast allergy, asthma, or multiple drug allergies. In practice, many centers do not routinely discuss LOCM versus IOCM with patients, mainly because patients cannot usually assess the technical details of these agents, and also IOCM is very costly. Still, informed consent should ideally include possibility of allergic reaction, availability of safer but costlier alternatives, emergency preparedness in the radiology suite. In standard practice, informed consent forms include this contrast allergy risks, usually under the section rare but serious risks. Radiology guidelines also state that patients must be informed upfront about the possibility of hypersensitivity reactions, even if rare. However, regarding this incident, none of the articles confirmed whether in Leticia's case the allergy risk was explicitly mentioned in the consent form or not. So, a very important question, will the medical staff face legal action? As of now, there is no public report of punishable action against the hospital or staff. The hospital has stated that all procedures were carried out as per recommended clinical protocols. If future investigations prove that allergy history was ignored or emergency protocols were not followed, legal action may occur. But so far, no FIR or no investigation report has been made public. So, well, friends, while we cannot completely prevent these reactions, still awareness, risk assessment, pre medication, and emergency readiness are the key to saving lives. Every precaution can make a difference and possibly save a life. So, thus, today we have discussed this very important case in short, and soon I will be back with the next interesting and important video. So, stay connected and thank you.